Hello guys, welcome you all to Know Your Calling. Here we have started this venture to help people match their branch of choice. Here I have Dr. Sanjana with us, who is a consult faculty in neonatology at AIMS Mangalgiri. Um Ma'am, I'd like you to introduce yourself, like what have you done and what are your branch and everything.
Sure. Hi, everyone. I'm Dr. Sanjana. I did my MBBS from Kasturba Medical College, Manipal, after which I did my MD in pediatrics from Jipmer, Pondicherry. And then I went on to super specialize in neonatology from Lady Harding Medical College, which is in Delhi. So I chose pediatrics because of the way pediatrics department was in Kasturba Medical College in my UG. That was what pushed me into choosing pediatrics. So Dr. Nalini, she was the HOD of pediatrics then. So she was a very legendary pediatrician. She's very well known, and the way she was inspired me actually to go into pediatrics, and the way they used to conduct clinicals for us. That was also big. A role that had a big role in the way it shaped me to choose pediatrics as well.
So what is something that you really like about this branch that you have chosen, like pediatrics?
Right. So there are few reasons. So one thing was once I came to final year, I once I went through all the subjects of MBBS, I was very sure that it will be something on the medical side. I was very sure that I'm not interested or very good at surgery and surgical topics. They didn't interest me much also. I was very passionate about general medicine and about pediatrics, both sort of equal interest, and I had not made up my mind which one it would be. Actually, to be honest, as a subject, theory wise and other things, I loved medicine more because there are certain aspects of pediatrics which are not something fully into my interest, like calculating calories or diet charts. These are not something I like. I like more of the symptom analysis, diagnosing something, and then managing and then evaluating the symptoms, looking at the response to treatment. Something like that was more of my interest. So general medicine would have been perfect, but there was something else which shaped me into choosing pediatrics. So that was my wanting to do something for the women and children of the country. So women and child health was something I found during my pediatric clinicals that it was really lacking in our country. There was not much support for children and women in this country. And by supporting children, I saw the miracles that could happen during the clinical posting. I saw the resilience and the excellent responses to treatments which children had that I never saw in adults. The way they bounce back from difficult situations and the way that can make a long term impact on that child's life and on the society was something I started observing during my pediatric clinicals, because I used to see these thalassemics who used to come for their regular blood transfusions, and I saw how well adapted they were to their life and how well the pediatricians in KMC Manipal used to teach them to modify their lifestyle, and then they used to do so well. And then you had diabetics, childhood diabetics who ended up having chronic disorders, childhood cancers. All these have excellent response to treatment, and they can make a whole life of difference for the child. Whereas doing a lot for, say, an alcoholic cirrhotic of 80-year-old who has probably brought himself into the situation, not due to, it's not that he's at no fault, he's kind of responsible for this, partly at least, for where he is now. And there's nothing much then that you can do. If you advise the similar lifestyle changes to a child, the responses are dramatic compared to an older age group. So that kind of fascinated me a lot. It's actually a very miraculous branch. You have resuscitation survivors who go, like, who had heart rate of 0, and they bounced back to life literally because of our CPR, and now they're going to school, they're doing so well. So you can see all this follow up happening right in front of you. So it was after seeing all this that I thought, if you really want to make a meaningful contribution to the society, then I should choose pediatrics, because one is I have a basic interest in the how the subject is. Basically, it is somewhat like medicine. Second thing, I saw the effects it had on the children and what I could do to make a difference in the society. It was becoming more clear to me. So I thought it will be a very purposeful profession for me to follow lifelong. So these were, so it is not just this, as you can see, it's not just the interest in the subject alone. That is, yes, very important. Core passion has to be there for the subject, but some more things might influence you. Like, once you go into your midlife, you must not question yourself, what am I doing with myself? You should be in some purposeful profession. So make
Wow, that
sure,
is so inspiring of you.
I think that should come into our minds whenever we are choosing, I
Yes,
think.
that is really very inspiring. Thank you so much for your like experiences.
Thank
Um,
you. I hope it helps many of you.
yeah, the other aspect of like not just about our theoretical part and the actual practical living scenarios are also helpful.
Correct.
Yeah,
I mean, that goes on to show that if your college is good and the way they conduct clinicals and rounds is good, it can actually turn around a MBBS student and, push him into that profession. Sometimes I also feel, the way the physicians are, like, if you meet really nice people, like humans, who are doctors who show their humane side to you as consultants, I think that also sort of pushes you to choose that profession. Like, I met really nice people in medicine and surgery. It's not that the people in surgery were bad or something, but a few were exceptionally very nice in these branches. I hadn't met people like these before. So I think sometimes when you see humane aspects or aspects of doctors as people, which touches your heart, I think that also pushes you to choose that branch sometimes. So these are things I think you guys should keep in mind.
right. So, what are certain cons that you can think about your own specialty that people should keep in mind before selecting or going for MD pediatrics? Like just before that,
Yeah,
uh, like you can share with us.
sure. Should I go with the pros first, or is it okay to go with the cons first? Shall I
I think
go
you can share
briefly
us
with the
both
pros?
pros and cons, please. Yes,
Yeah,
yes,
I first
sure.
I'll tell you the pros. First thing is that it's a very niche specialty in itself. So it can kind of serve as an end specialization. So it's not very mandatory to have a super specialization in pediatrics yet, though it might become in the coming years. But still, it serves good enough because if a pediatrician is there, he's the only one who's going to see the child. No other adult specialists are going to touch the child. So you will be quite niche already after your MD. So that's definitely a step ahead compared to general medicine or general surgery. Second thing is that it's a field which gives you a lot of positive results. This is one where even oncology has very good rates. You don't need to stick to very palliative processes or something. There are definitive treatments and there are very miraculous responses when it comes to children. So you see good responses to treatments that might serve you well even in the private sector. So if you aggressively treat, you might get positive results which may serve to increase your name also. Third thing, earnings are good. Like, you can set up a clinic anywhere, and there are some basics like a well baby clinic where just a well child comes to visit you for a routine checkup. Those also can help you earn money. So earning money will never be a problem in pediatrics. And just routine vaccinations. So some routine things can be done, not like covering specialist diseases or something. Routine things can also serve you, and earning money money will never be a problem in pediatrics. So financially it's good, but that solely should not be the driving factor, because if you don't have passion for it, it's going to be difficult anyway. So these are some of the pros. The cons would be that, you will have, it's very different from the general adult specializations, right? That's the only branch which deals with children. You don't have any other branch which is dealing OBG, surgery, all deal with adults medicine. So you will have to unlearn a few things which you learned in MBBS and relearn those things when you start doing residency. So residency is very intensive. It's not easy, and everything is very different from what you would have done in internship. Like, the be it the sampling of children, intubation of children, whatever you do in adults, it is not that they are just miniature adults. No, it is very different. It's an entire relearning process which will happen. So to shape up your mind to understand a child's physiology and mental thinking and the effects it has on him as well as on his family, all that requires a lot of unlearning of some basic principles what you learned from MBBS and relearning them, which can be very challenging. unless you have a core passion and you are very sure that I want to do something for children, if that basic motivation is not there, it can become very difficult because it's a labor intense residency program. There are some residency programs like medicine and surgery where it becomes a little cooler as you become a third year resident. As years go by, it becomes a bit cooler. But pediatrics is not going to be like that. Even after you become a consultant, it's going to be quite hectic. You're going to be having a lot of emergencies and things like that. And since you're the pediatric consultant, you will always be called for. Whereas in adult medicine, usually the interns and the residents at their level can manage most of the things. The consultant doesn't need to be called that often. So if you're ready for all these busy schedule and emergencies, it's a little busier compared to many other branches, definitely. Then you can definitely think. If you don't mind all that, then you can definitely think of it. That is some of the cons, I would say.
And can you share the light on the work-life balance of like being a faculty currently and like during your years of study as well?
Yeah, so work-life balance will be a challenge. It also depends on if you're bent on scheduling a certain number of hours. If you're counting the number of hours and you're going to allot it for your life and for work, then it's going to be a challenge. If you just focus on the quality of life that you have, then and you don't worry about the number of hours that you get, then it is going to be probably better in pediatrics because hours are going to be a bit more limited compared to many other fields like say adult endocrinology, rheumatology. Those are all definitely cooler branches. Dermatology, ophthalmology, ENT, these are definitely cooler branches. So work life balance, one thing I would suggest is it is going to be challenging to maintain that when you come into pediatrics during your residency and even afterwards. But once you are passionate about it, I'm sure you will be able to make up for the time with quality that you do. So, like, I have a child of my own, he's a toddler. So, my challenge is to allot enough quality time to him as well as to the work. So you will learn that with time. As long as you have your priorities are clear and your passions are clear, like you know you want to be there for your members of your family. You are clear you want to do certain things for your profession. If you've figured all that out very clearly and you set clear boundaries, then it will be fine. But yes, definitely it will be a challenge. You will need to work on it, but working on that will help you grow as a person. You will learn how to manage multiple things. You will become more efficient, and you will learn the art of life and things like that.
How important is support of family in or doing our endeavors, like as an MD pediatrician when they pursue residency, post that, like how does that influence? Like not everyone is well supported these days, and like so what could be the challenges that they can think of in their mind before selecting their branch?
Yeah, definitely family support is needed in branches like pediatrics because it is very labor intense and you may get calls anytime at night and it's an emergency branch. So, family support is important, but again, it depends on how passionate you are, how much you're willing to work for it. Then, if you're basically very interested in the field, then I think this will be a minor challenge only. Not having a supportive family will become a minor challenge, and it's all about turning your people around and making them realize how passionate you are. But I think in general, medicine itself, all the branches do require some amount of support more than other professions, I feel. Because sometimes even I see pathology residents, they are working till late night evaluating all the smears. So it's not very cool for anybody. Nobody needs to defer taking up pediatrics because of that. Because that challenge will come in every other field also. It's not that nowhere else you will need support or anything like that. I see even psychiatry residents having night duties and their children being left in the hands of caretakers. So they're not able to give enough time to them. So it's not that psychiatry is a cool branch, you can take it. It's not like that. So just that lack of family support alone should not deter you from taking it because in medicine the MD or the degree which you do is going to be like a marriage for you. You're going to be married to it lifelong. You'll need to work on the branch day and night. So you better make sure that you're enjoying the branch which you're doing. Otherwise, every minute is going to be like a torture for you if you select the wrong branch. And please don't hesitate to spend 1 or 2 years extra. It doesn't matter. In the long run, it is not going to matter. As long as you get the branch and you do it from a good college, it is all worth it. Yes, it is going to be very tough listening to society and family members and ridicules and all that. But lifelong, you are going to get tortured by the branch. So you better make sure that you take up something you enjoy, and it's worth giving it extra time in the beginning. It's okay if you don't clear it in the first attempt. It's absolutely okay, because our profession is tough. So these things should not deter you from taking pediatrics, because every branch is nowadays very hectic. Even as in medical college faculty, they have night duties even in psychiatry and other branches. So definitely, just for that reason, don't give up your passion if you really like it as a subject. That's what I've noticed in these years.
Um, Ma'am, how do you think that working as an MD pediatrician will change from, like, working in metros, like working in a smaller town? Like, what are like different aspects of that you have noticed in your life? Can you please guide us on that?
Earlier, MD pediatricians used to have good scope in metro cities, but over the last 10 years, metros have started getting saturated. Now there is good scope in the tier 2 and tier 3 cities for MD pediatricians. So, just being a pediatrician without any further specialization, you will do very well in tier 2 cities, like the smaller towns, not the major metros. Metros are going to be really competitive if you have done just MD pediatrics. So if you want to settle down in a metro due to other things like, say, quality of life or facilities or something like that, schools for children or anything else, there can be reasons why you may want, personal reasons why you may want to settle in a metro. If so, I would suggest you have a niche area of specialization within pediatrics. So there must be a valid reason. You must be the one of the best ones at some particular thing in pediatrics, which only you can be referred to. Like, say you do a DM or a fellowship in one particular area, and you keep working on that and become really good at one particular thing in pediatrics, so that that sets you apart from the other countless pediatricians that are there. So that is one thing that would definitely help if you're choosing to stay in metros. Now, practicing per se is going to get influenced by a lot of other things, right? Personal things as well, not just professional. So for that, this can be one way to overcome that. But generally, this is the scenario. If you're going to say a tier 2 city, MD pediatrics is very good. You will do well.
All right. Uh, from what I have learned is like being a pediatrician is like mostly like if you're passionate for it, you'll be able to do that. And like, what do you think about like the the hobbies aspect of the other life? Like we have got marriage, then we have got our hobbies as well. We have got our free time as well. Like, and how do you think that a person who is trying to choose that this is the branch for me because I want to learn it, so how best they can manage time for this, like, and is that even possible with our branch or not? So can you please guide us on that?
So that is, I think, going to be a challenge for a lot of the branches. Surgery is going to be very hectic. Medicine is also quite hectic once you decide to do from a very busy college. And so it's true of many other branches as well. Pediatrics is one thing different in it, is it's a little skill intensive. Like, you need to learn a lot of skills. You have to be very skilled at it. Just being good with talking and just prescribing something on paper is not going to work. You have to be very good at all the skills required to do procedures for a child also. So that way it's going to be a bit more intensive, but that is going to get easier with time. So I think managing a family, everything will go on as usual if you consider it just like any other residency, and you just put your full heart into it for the hours that you're there. And maintaining the hours and cutting off after work hours is something purely personal which you need to inculcate. I think busy branches like pediatrics will somehow force you to learn that, how to how to maintain boundaries and how not to overexert yourself. I think that will be a good learning experience for anyone who takes up pediatrics. So I have seen immense number of colleagues. They all have a successful family life. They have kids. Marriage happens on time. So everything goes on well, and they have a good family life. They go for holidays, and they have a equally busy and fulfilling career as well. So it's very much possible. There is hardly few who do it, who don't get married by choice or something like that. It's not because of the branch per se. I've not seen that happen in pediatrics. Maybe somehow doing pediatrics also makes them more family oriented, probably. Because pediatrics is one branch where you're not treating only the child, you're treating the entire family. You're also treating the impact that illness of the child has on the family. And many times it is like counseling is required for the family members than for the child regarding the illness. So I think that people learn to become very family oriented and how to handle situations in the family. So I think they become more good at having a family of their own when you do pediatrics.
Hmm. So, that is like very great information that you have given to us about the free time and the hobbies that the people actually will find it very challenging to pursue, as you say.
Yeah.
Ma'am, what do you think about the super
They
specialization?
they do make time for it. I've seen pediatricians, they become all rounders because they become more efficient at managing time and doing things quickly. So it definitely makes you more efficient as a person.
I think practice makes everything better, I guess. Like once they get into it and like fight it out, I guess everything settles out
It will.
eventually.
It will. Definitely it will. No doubts.
Yes. Ma'am, about the career prospects like of choosing to MD pediatrics, like if one wants to do ahead in life, like so let's say there are options like super specialty and also fellowships and all. So, ma'am, like you did your neonatology. So like how should like a person just before uh, choosing MD pediatrics, like should actually look forward to those things like previously, or should they not? Then there are doubts in their mind, like should we, if we want to stay in metro, like what should we do, and things like that. So there are fellowships and super specialty options after MD pediatrics. So how should we orient ourselves to that?
So you can start thinking about super specialization. Best time would be once you finish all the subspecialties during your residency. So say by the end of third year or something, you can start thinking about what next. So there are many options that you can do after pediatrics. One is you can just do senior residency in pediatrics at a good institute of national importance for 3 years, and then just practice as a pediatrician in a very good setup with handling all the aspects, including pediatric intensive care, OPD, IPD, all that. That is one option. Second thing, which I feel is more necessary these days, is that you need to have one niche area in pediatrics. Now it is broadening a lot. There's more information coming into pediatrics. So general pediatrics has become very vast now, like medicine. So even if you may not choose to utilize that degree much, better to still do a degree, be it fellowship or a DM, and have some area of specialization which you are known for. That will always be better as a backup, because in future we don't know how much the competition is going to increase and how much more the field is going to widen. Then it may become more and more mandatory to kind of intensively specialize in something within pediatrics. So in order to be future oriented, I think it's better to always do a subspecialization anyway. It might still what do you say, it may still extend your student life by somewhat some more years, and you may face all these family issues, but I think these are just trivial and it should not come in the way of your long term goals. So it has become more and more necessary these days to think about super specialization. Now DM versus fellowship is a bit dicey. It is more like if you're more into academics and research, you can do DM. If you're more into just specializing in some particular kind of cases, then you can do fellowship and then you can do private practice. It is more like that. A DM sort of prepares you for a more academic career, though many DMs do well even commercially, but still. So that is a choice which you will have to make based on whether you're willing to spend 3 full years and you're willing to do intensive academics and residency again like your MD. Or fellowship is going to be a little cooler. You'll have more freedom. You'll be treated like an employee and not like a student. So that sort of life balance will be there, and you'll just be seeing clinical cases. There'll be no thesis to submit, there'll be no research work, there'll be no classes to prepare for. So if that sort of thing is there, and your idea is just to stay in the metro city and practice, then fellowship may be better. So those sort of things you can choose based on multiple factors. Actually, single factor may not help you decide. But if said and done, whenever possible, try and do a DM, for whatever it is. But if it's taking too long and you're really feeling it's taking a toll on you, then it's not worth it.
So, ma'am, I'd like to now ask you about the things to be kept in mind before choosing any college for taking up MD Pediatrics as branch. Like, what should be kept in our minds?
Yeah. So first thing is, of course, the case load in that institute. So it's better if there's a higher caseload, then it's always better. So any of these reputed state government colleges are very good, in fact. And another thing is, there's a slight variation in surgical versus medical branches. For medical branches, institutes of national importance are better. For surgical ones, the state colleges are better because you get more hands on there. Again, uh, finally, the result will come, and whatever you're getting, you have to make the best of that. It's not that if you're getting a good INI or a good state college, don't give it next year. You take one of that, it's fine. So don't waste another year if you're already getting either of it a good institute. So that's fine. It's not that somebody said surgical branches you don't get any hands-on in INI, so I'm not going to take that. If you're getting PGI or AIMS, definitely you should go for it and not waste another year. But generally the trend is like that. Suppose you're getting both, then that question will come. Another thing is academics will be more structured in the INIs. So that is one advantage of getting INI CET, and your stipend will be higher. So you can actually have some savings also if you're working in an INI during your residency. But that should not be the sole driving factor, because just 3 years and you need to do it from any good center with high load. That is the basis. And there'll not be a lot of spoon feeding and teaching in residency period. You'll have to do a lot of self reading after seeing the kind of patients that you see. Case based reading will be done. So self study is the most important thing. So don't think of choosing a place with good teachers or something. There's no PG classes are going to be just once a week or something. So that's not going to make a very big difference as much as in UG. So just focus on a center which is very as old as possible, with heavy caseload, with as much infrastructure is well established already. Right? That should be the main focus.
And what about the DNB pediatrics and the MD pediatrics? Like, how does that differ college to college as well?
Yeah. DNB will be very heterogeneous in the sense DNB is being offered by a lot of hospitals, but again, one of the most reputed private hospitals, very old time, with lot of old time clinicians working there, and heavy caseload with lot of infrastructure, like say Gangaram Hospital. They have all the infrastructure, advanced equipment, everything is there. So DNB is worth doing from a place like that. So the quality of DNB students varies a lot compared to the quality of MD students. If you do MD from most of the colleges, it is sort of uniform. You can expect the level of skill and competence that the PG has once he comes out of MD, but it's not so uniform for DNB, which makes it difficult for the people employing them as well. So when you're doing DNB, make sure you aim for the most reputed hospitals, the topmost hospitals in any big cities like Apollo Chennai, the big metros which have the handle the biggest loads, and who have the scope for the majority of the equipment and most complex procedures are going on. Those sort of institutes should be chosen. Otherwise, it's not worth doing DNB. It's better to appear again next year. You please give it multiple times the exam. It is okay. If you're passionate, you will clear it in one or the other attempt. So it's fine.
All right. So, like, we should always prioritize taking MD pediatrics over DNB.
Better,
According, it's
but
better.
if you're doing DNB from a very good institute, it is well worth it. And on paper, DNB and MD are recognized as equivalent. So that is okay. On paper, you're not going to face any problem. It's only while
All right.
handling patients you're going to face problem if you have not done it from a good institute. DNB, I
Uh,
mean.
okay. So, settling as a DNB like pediatrics won't be as difficult as like it won't
No,
have
it's
any
not
difference.
difficult. No, you can practice very well. Provided you had good experience during your DNB, that confidence will show and you will attract more patients based on your competency.
Okay. So, ma'am, tell me something about the future of your like branch, as in like how AI is going to affect this in like current next to 10 or something, 20 years or something from now. How is
That's a
that
very
going to
good
affect?
question. Yeah.
Yeah.
So there's been a lot of talking here about AI and how it's going to affect medicine. So in that, I can say is going to have very specific. Pediatrics is going to have very specific applications only because the history taking and the way pediatrics is managed is still more of an art than a science. So wherever art is more and science is less, AI is probably less likely to affect, and it's more individualistic in pediatrics. Like every case is highly individualistic and the management is very very different. There may be two dengue cases, but the way they are managed will be entirely different. The two children are not going to behave the same way at all. So in such places the role of AI is going to be less. The role of AI I predict is going to be more in places like radiology, where you have a lot of machine based interpretations and things like that, ultrasounds. So I see more there. Pediatrics is probably not going to be affected too much, except in places where you can use an algorithm. There are specific disease conditions like neonatal sepsis and some other things which use a scoring system or a definite algorithm of management. There you can probably introduce AI just for implementing something, but in decision making it is probably not going to affect at all. There definitely human factor will be needed in clinical branches like medicine and this pediatrics. Maybe for the per se surgical procedure you might still use AI, but the decision whether to operate or not will all entirely be human based. The machine is not going to take decisions for you. So I think medicine still has a long way to go before it can fully take in AI. It's still a human science, so it's
Yes.
going to have a lot of variation at the end of the day. So the take up for AI will be less, I think, in medicine. We can certainly look at ways to make life easier for us in some ways, but it may not change too much for us.
Makes sense. Makes sense. Uh, I think we should wind up this sessions. I guess like all of all of our people would have our doubts cleared by now, like choosing how MDA pediatrics and from a neonatologist perspective, like how would that differ? Like, and ma'am, I'd like you to like have the stage for yourself. Like, what do you want to, like say something to inspire the budding pediatricians of our country?
Yeah. In fact, I'll take this opportunity to just talk to all the MBBS graduates here in our country because this has been something which has been weighing on my mind from a long time. So, I come from a family of doctors and I was discouraged highly to choose medicine because they were in this profession and they did not want me to undergo the trials and tribulations that they went through. So there are a lot of frustrations. The road is very hard. But I was very clear that engineering did not suit me and other branches did not suit me. And I was very clear about my passion to do medicine. So when I took up medicine, it was very much harder than I expected. It hit me hard. But I was very motivated because I knew the core subject was something that really interested me. So I could see that. So even if it took a lot of hard work, I was willing to do that. And and the pathway just went on. People just give you these false assurances, right? After 10th life is easy, then they say after 12th life is easy, then they say okay, just get into a graduation, life is easy. It's not like that. Life never stops being easy. In fact, life is tougher once you finish all the degrees and you have to start working and handle family responsibilities. Then you think, oh, MBBS was such a cakewalk. So don't listen to all that advice. Without challenges there's no life. If there's no challenges, that means you're not living at all. So if you're coming across challenges, you be thankful that you're alive. So same way, medicine is also going to be a pathway which is full of challenges, but let that not deter you at all. Because today, looking back at the entire 12, 13 years that I've spent studying, I only recently started working, whereas all my cousins in engineering are already working from 5, 6 years and they have a big bank balance and everything else, all the materialistic things they have. But I have absolutely no regrets because this path has been so satisfying. There is nothing else I would have done. this is exactly what I wanted to do. And say, even if this is exactly not what you wanted to do, something is different than what you expected, still go for it. If you have got an opportunity to do MBBS and something further in it, please grab it. Not many people get this divine opportunity to be able to treat someone else, to be able to diagnose someone else. These are kind of like superpowers. I mean, that should not be used to inflate your ego, but I mean in a purely scientific way. They are genuinely very good powers to have, and it gives you a lot of insight into life. And I think materialistic pleasures and the hurry to reach somewhere should not come in the way of you genuinely learning something good. So if you get an opportunity to do medicine post graduation, please do it. Even if it is not the branch which you expected or something, see what you like, leave it and take something else. Even if it doesn't suit you, finally learn to enjoy that process. Medicine is a beautiful science. Just learn the intricacies of it, and I'm sure you will like it a lot for what it is doing to the people, be it surgery, be it ophthalmology. See the effect it has on the people and learn to enjoy it for what it is. Don't focus only on the negatives, like the tough path it has or the working hours. So go for it, enjoy medicine. It's a beautiful science. Please go further and further. How much ever you can study more into it, you do it. If you get the opportunity, please further specialize as much as you can. There's a beauty in studying deeper and deeper into it, and you start living life in a better way once you read more about medicine. So your quality of life improves. That is
Right.
the thing I would like to tell everyone.
Thank you so much, ma'am. I think from her, I've been inspired a lot as well, and I guess you guys have as well. So, like, and at the end, I just want to end this session on this note that where there is a will, there is always a way. And
Definitely.
wish you guys all the best.
All the very best.
Yes.
Thank you.